At the same time, St. Joseph's Hospital, as of Friday, began contacting those who are 85 years and older in this calendar year who live in Hamilton and who have received care at either St. Joe's or at Hamilton Health Sciences over the past 6 months to try and get a running start on booking people into the clinics. And so they were quite successful. So earlier today, St. Joe's West 5th COVID vaccine clinic began providing immunizations to those 85 and older. They have filled completely today's appointments and are well on their way through Tuesday and are going to continue booking out over time. So they've got more than 500 appointments booked so far, and the booking is continuous as we go forward. At the same time, Hamilton Public Health with our mobile clinic will be setting up some pop-up vaccination clinics for those, again, 85 years and older at Salt Fleet, at the Municipal Service Center in Glanbrook, at the Ancaster Rotary Club, the Dundas Community Center, at the Harry Howell Arena in Waterdown or Flamborough. And then we're looking at putting some additional clinic sites in neighborhoods that are disproportionately impacted by COVID-19 and plan to announce those in the coming days. I do want to remind everybody that these are by appointment only clinics. They are not drop-in clinics. These clinics, for example, at the community centers and Rotary Club will not be operating every day, but will be scheduled in with our mobile teams going there in order to provide service closer to where people live and for those who may not be able to access elsewhere. So walk-ins are not permitted. As well, it's really important as we move forward, and we could totally see the pent-up demand and interest in getting vaccinated as we opened up vaccination beyond healthcare workers and long-term care and retirement homes this weekend. It's very important that those who don't meet the eligibility criteria of 85 or older and living in Hamilton to not call our hotline. There is no registration system in place at this time. As you may remember, the province is putting out a booking system as of March 15th for those 80 plus. We did want to get ahead of that because we had some vaccine availability and were able to get the clinics up and rolling. And at the same time, we are waiting for that system to come in, get put into place on March 15th, and then start to move forward with those who are over 80. Those 80 to 84 it would be for us as we go forward. Following that, you'll continue to see the rollout in terms of the age and stage as General Hillier announced last week. Continue to see that roll forward over the coming weeks and months. As well as Paul's talked about, over the weekend, our mobile vaccine clinic team worked with Shelter Health Network and shelter staff to get COVID-19 vaccines out to workers and residents in our shelter system because of the concerns there in our shelter system and the challenges that they are experiencing. Those are going to continue through tomorrow. And so far we had 132 vaccines administered on Saturday, 118 on Sunday. There are 90 appointments booked for today, and we're hoping somewhere about the same number will book in for tomorrow. So as we get to have more and more clinic sites, it'll be a bit of a list that I go through, but if you remember, we still do have our HHS fixed site clinic that is up and running and is giving second doses of vaccinations for healthcare workers at that site. And as of the end of last week, we restarted administering first doses to to other healthcare workers. So there is a separate process for registration of community healthcare workers. They can register through an online portal, which is open to them, and that opened on Wednesday. Again, HHS is a by appointment only clinic, and so people register and then they'll call out to book people in. Unfortunately, we don't have the capacity to do an online booking system for everyone at this point. St. Joe's was able to create this as it went forward, but it doesn't have a broader capacity, and we are waiting for that provincial system to help us continue to move forward. So just in terms of the age groups with that provincial system, if you recall, it was third week of March for those 80 and older, April 15th for those age 75 plus, May 1st for those age 70 plus, June 1st for those 65 plus, and July 1st for those 60 and older. Of course, you can find information about registration and all those things on our website at www.hamilton.ca//COVID vaccines. In terms of how many we administered now, we're up to 36,513 doses at the end of day yesterday, 11,300 of those through the mobile site and 25,200 through the HHS site. And I just do need to stop for a minute and just give a shout out to all the healthcare partners. You've heard me name them all through this Shelter Health Network, St. Joe's, Hamilton Health Sciences, paramedics you heard Paul talk about. They're helping with vaccinations too. Our primary care partners are working to support this. So there's just lots of people that are working hard to support the vaccination efforts. But the blunt reality really is that we are still at a very critical point in the pandemic. Our local trends are, at best, sort of at this bottom of the curve and looking to be perhaps on the way back up. We've had an increasing number of active outbreaks again. We're seeing an increasing number of screen positive variant cases, and our confirmed variant cases we're getting in as well. So it's absolutely essential that we keep our guards up to protect ourselves and our community members. So even if we have been vaccinated, we must keep practicing public health measures, staying home if feeling unwell, getting tested for COVID-19 if you have any symptoms or have been in close contact with a confirmed positive case of COVID-19, limiting gatherings to only members of your immediate household, maintaining a physical distance of 6 feet, wearing a mask or face covering indoors and outdoors, and if you can't maintain physical distancing, and washing your hands frequently. We have, in keeping with the province's issued guidance, we've updated our COVID-19 case management and outbreak management practices to address the concerns related to the variants of concern. And so you'll see that we have an increased sensitivity to identifying contacts. So it doesn't take as much to judge somebody as a close contact as well. If they are felt to be a close contact, the things that they need to do in terms of quarantining, getting tested, all of those things have been updated as we go forward. So very much have the methods in terms of continuing to go forward with the control, but very concerned to make sure that we're all doing everything we can to mitigate that risk, given the state that we're at here in Hamilton and in Ontario more broadly. So that's it from me today, Mr. Mayor. Back to you.
Thank you, Paul. Thank you, Dr. Richardson. And the message is that public health measures are still very, very important. So please continue on, even if you've been vaccinated. But there are other ways that you can help. So you can download the COVID Alert app on your smartphone through the App Store or Google Play. You can donate to the local food banks, including Hamilton Food Share or Food for Kids or the Good Shepherd, to name just a few. And there's certainly a high need out there in our community. So whatever you can contribute, cash or food, would be very, very helpful. If you're in good health, consider donating blood. Visit blood.ca to book an appointment at the Canadian Blood Services in Ancaster, and continue to shop locally as much as you can. So the hometown hub.ca is very much in play, and so a lot of listings there of folks that you can purchase from locally through online resources. So keep doing that, and I think that supports our local businesses as much as possible, whether they're restaurants or shops. Some of them are open, some of them are waiting for your online orders. So please do avail yourself to those online capacities through the hometown hub. And as well, you can check on your neighbors, especially our elderly neighbors, to make sure they're doing okay and have everything they need. There's a lot of folks in our community that are isolated. Family may not be connecting as often as they could or should. So neighbors could step in and do their part as well, just to look after those that need a little additional care and attention. So whatever you can do there, all the better for our broader community. And as we continue to say, we are in this together. So we'll continue to work on getting the vaccine into the arms of individuals as quickly as we can, given the supply. And we still ask for your patience going forward, because this is going to be a bit of a bumpy ride. And I know that everyone wants the vaccine as soon as possible, and we want the same. And so we're going to get it to you as soon as we have it. It will be delivered, and I think the doctor and Paul have laid out where we're going to do that, the staffing that is prepared and ready to go. And so when the time comes, we are ready to put it in the arms of individuals in our community. So we'll await the federal and provincial supply that flows into our community, and as soon as we have it, we'll get into the arms of individuals in our community based on the prioritization that the province of Ontario has laid out. On that, Jasmine, I'm going to turn it over to you and let our media ask questions.
Great, thank you, Mr. Mayor. We have 5 media joining us today. So just a reminder to everyone that we'll start with 1 question and 1 follow-up for each of you, and I'll call on you when it's your turn. We'll start first with Holly Mackenzie Sutter from the Canadian Press. Holly, you can go ahead.
Hi, thanks for that. I just wanted to confirm, if you can, how many appointments like vaccinations were carried out today at the clinics for 85 and older?
Thanks very much, Holly. So today we had 250 appointments slots for St. Joe's. So we'll know by the end of the day how many they were able to do. We wouldn't have that yet. There were 250 appointment slots.
And is that rate going to be holding steady, I guess, throughout the week? Because you mentioned 500 booked already. So it's kind of the capacity seems to be 250 a day.
That's right, Holly. So our capacity within the St. Joe's clinic site is 250 per day, and our capacity in the mobile clinics, once we get those up and running, will be another 200 per day.
Great, thank you, Dr. Richardson. Next question will be to Nicole Martin from CHCH. Nicole, you can go ahead.
Thank you so much, and happy March 1st to everyone. It's been a pretty busy day over at the St. Joe's West 5th Clinic. Lots of excited people to get their shots, but some family members had to call over 300 times to get a hold of someone. So I'm just wondering how many staff members are actually answering the phones and how many calls you received this weekend.
Thanks, Nicole. So at this point, we have 11 people who are on the phone line answering calls. St. Joe's also has a call bank that's calling out to people as well to give them appointments, because remember we have those 2 processes going on where they're going through their charts and calling out people as well as us taking calls. And in terms of the numbers of calls, our phone line is able to handle 150 calls at a time. But we know that it is over that. We can't though count the calls that go over that, if you see what I mean. And we've been able to register 1,000 people. So I don't have the full number of calls, but that's where we sit today. We're going to continue to monitor it as we go forward, see how we're doing in terms of the number of calls, the number of registrants we're able to do, and keep monitoring that and seeing what else we can do to improve it.
I'm just wondering also, who is the telecom provider? Is it an issue with their system or just not having enough people to answer the calls?
I don't know who our telecom provider is. Paul, I don't know if you know that.
So my understanding is we work with HCE Telecom to do some of this work, and the reality is that our systems at the city, we're not a call center based piece. We do have obviously our customer contact center, but in terms of the volumes that we would have experienced this weekend, it's not even, the sense is that we would have had to completely re-engineer our entire system, which obviously we wouldn't have had the time to do, and you wouldn't do for 2 weeks. And I think it's important to note, I know the frustration is there, and certainly it's not a great scenario, but the other option was to simply wait until the province's system comes online, and we just weren't prepared to do that either. So I think that we're doing everything we can. The more you can clear the calls, the more the calls will come in. But it's not an issue where our provider is at fault either. They were trying to look at ways that they could expand the capacity, and they will. But really, we just put more people on, we clear the calls faster, and that allows the volume of calls to continue to come through. So in no way was this something where our provider failed to live up to the expectations. In fact, they're trying to look at every option that we have in an immediate fashion, and quite frankly, for a short-term fashion, to help make it a little smoother for folks to get through.
Great, thank you, Paul. Next question will be to Tevia Morrow from the Hamilton Spectator. Tevia, you can go ahead.
Thanks very much. Paul, just a question for you. I was wondering if you could speak a little bit to the capacity at the Bonetto Isolation Center. How many people are there, and how many you expect to head to the central one that you've just opened up?
Sure. So Bonetto can handle about 25 individuals at a time, and it's we're going to have it to full capacity. We've redeployed some staff so that we can get to full capacity for our Bonetto site. So that's good news. The site at Central Memorial could go up to 30 individuals if we needed it to. We don't expect that it will get there. Today, we're only expecting a couple of people to go, and so it's a numbers game where we didn't want to have a challenge where we didn't have any isolation spaces at all. So we've opened this up as a relief, but one of the reasons why we have so few people going there to Central Memorial today is that we actually had a number of people go through their isolation period and are no longer in our isolation and shelter spaces. So it's a constant job back and forth in terms of who's in and what space we want to have available. But we were getting to a point where only having 1 or 2 beds available on a nightly basis just was cutting it too fine. The real trick to this and the real trick to stopping the spread is to isolate people quickly. And we can only do that when we have multiple spaces available. So we've redeployed 20 city staff today. They'll be working both at Bonetto to ensure it can be at its full 25 capacity, and they'll also be working at Central Memorial. So that will grow over time. But we actually don't anticipate it will get to its full 30 at Central Memorial, but it's there if we need it.
Thanks. As a follow-up, so what's happening at the Salvation Army right now? I take it there's still people who are, sorry if I understand correctly, still isolating there? And is there a plan for something to be done while people are not there?
So there are at the Salvation Army today, the update I've had is that there's 50 cases, including 39 residents, 11 staff. There are people at Salvation Army who are not COVID-19 positive. So this happens in shelters. They may be an outbreak, a single staff case or a couple of residents, but that doesn't mean everybody is COVID-19 positive. We were isolating people there because, as I mentioned, we ran out of capacity within the isolation piece, but we're now decanting folks to the isolation center. So there are fewer of those at Salvation Army isolating in their rooms. One of the challenges that was identified for us through public health was that there are these pinch points in the physical layout where individuals may be coming just too close into contact with others who are not COVID-19 positive just because of the way people have to move through the center and exit in and out of the center, for instance, if they need to go out for to smoke or something like that. So we wanted to reduce the number of people that were COVID-19 positive as best we could. And that's why we set up the additional isolation shelter over the weekend.
Thank you.
Thanks, Paul. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. Dr. Richardson, with our reproduction number going up to 1.11 and our weekly rate above, 55, can you talk about, what you think about that and whether there's any chance you'll be looking at that emergency brake provision?
Thanks, Joanna. I'm looking at it every day, a few times a day, in terms of what's coming in terms of the numbers. So we absolutely are tracking the same data that we did before, but now with the added tests for the screening tests for the variants of concern, as well as the actual confirmed ones that come in as well. And so when we look at all of the data, and decide where to go each day. Again, as you've heard me talk about before, we look and see if there's anything in particular that is different that we need to add control measures for on a community-wide basis, and we don't have anything in particular related to that. But what does concern me is that these variants, particularly the B117 variant, we know is more infectious than others. It spreads more easily, and so very concerned about that. And that's why it's just so very important that people follow the control measures. So whether we're following it under an emergency brake provision that might need to get put in at some point, or we're just following it because it's the thing we need to do as a community to pull together, they're what we have at hand. They're the best measures that we have right now, and we need to keep up with them.
Great, thanks very much. And my next question is, do you have any information yet on the plan to vaccinate the adults who are recipients of chronic home care?
Thanks, Joanna. Yes, that's another group of the first phase, and the province has shared with us that they were developing some specific plans as to how to roll out with that group. So far, we've not seen those from them as of today. We don't have those in hand, but we are meeting with them regularly and hope that they'll be coming down at some point soon.
Thanks, Dr. Richardson. Next question is to Sarah from CBC Hamilton. Sarah, you can go ahead.
Sure. Hello. I was wondering what services are going to be impacted by the closure of the Municipal Services Center and when that will start.
So very few services. I mean, the reality is what's impacted is people's ability to come and see somebody face to face. The vast majority of our services, in fact, the only real service that we saw a problem with in terms of people coming in, and it's not impacted by the municipal service centers anyways, is marriage licenses. There is a piece of that that has to be done in person. But our city services are available online. They're available by phone. People can drop off things when they need to, for instance, from a planning perspective for plans. So the impact from a municipal service center perspective is that people are not able to book appointments and go see somebody face to face. And I understand for some residents that is their preferred option and their desired option. And maybe on rare occasions, a lack of ability to access in different ways. But we do try and make sure that all of our services are available, not only by internet and online, but also by phone. So if folks don't have either reliable access or don't have access to the internet, feel free to call the city, 905-546-CITY, and that hotline number can get you through to the services as well. So the impact will be a slower return to the availability of people coming into those service centers for direct service, and we'll keep the public updated in terms of how long that goes on for. I do want to stress that as of today, we've not announced all of the closures because it'll only happen as we need those staff. We're looking at redeployment, really ramping up more towards the middle of the month to the end of the month when these sites that Dr. Richardson talks about are not doing 250 a day, but are into the thousands a day across the system, and as we ramp up towards a much larger vaccine rollout. So they'll continue to be by appointment only at this stage, and then we will provide some advance notice to the community when they do have to curtail their services. And the other piece is City Hall will continue to be available from an appointment basis, and we expect at some stage over the next few months, City Hall will be back open to where you can come on site and receive services in person. So to go back, the impact really is, we're not going to have appointment-based services, in-person services, and we'll be encouraging folks to access the phone lines. But if you really do need to come for an appointment, that will be done through City Hall.
Thank you. That's good.
So we do have a bit more time, so we'll run through one more time and offer one more question to each of you. We'll go back to start with Holly. Holly, if you'd like a question, you can go ahead. Actually, it looks like Holly has left us. We'll go back to Nicole is gone as well. Okay, we'll go to Tevye. If you'd like another question, Tevye, you can go ahead.
Sure. I thought I'd just ask, have you heard of any cases of people at shelters who have had to go to hospital because they have become so ill of COVID-19? Or does everyone seem to be okay so far, relatively speaking, of course?
So the numbers are very low, and Tevye, we can get back with some of what we know. We do know that there has been some movement in and out of hospital. Sometimes that's the people have been in hospital and then they're looking to be discharged to the shelter system. So, yes, have people who have experienced homeless been in hospital? The answer to that is yes, absolutely. In terms of these recent outbreaks and things, there are not large numbers of people requiring hospitalization. But I can follow up and be a bit more precise with that. But it is a bit of it's not always the shelter system and driving that coming out of the shelter system. It may have been that they were COVID-19 positive and in another environment, sleeping rough in the community or not in a permanent location, and ended up in hospital and then were being discharged to the shelter system once they had recovered.
Right. Thank you.
Okay, we'll go next to Joanna. Joanna, you can go ahead.
Hi, thanks so much for the extra question. I'm not sure if this would be for Dr. Richardson or for Paul Johnson or for the mayor. I'm just looking to see if someone can talk about, why you felt it was so important to not wait for that provincial system to open up March 15th and wait until the third week of March to start vaccinating seniors. Can you talk about why that, you felt that was so important to go ahead now?
Sure, why don't I lead off, Mr. Mayor, and then I'll hand it over. So what we know, Joanna, is that the single largest factor that contributes to severe illness and death due to COVID-19 is age. And so We were working through with our long-term care home, retirement homes on getting those people vaccinated, because we know living in a congregate setting is, puts you at increased risk of acquiring the diseases we've seen with the outbreaks that have happened in many of our long-term care and retirement home settings. The other, as I talked about, the other goal we have is protecting our healthcare system itself. And so our immunizing our highest priority and very high priority healthcare workers has been a priority as well. And so we've been working on that through the HHS clinic site. But given that that need to protect those that are elderly, we did want to see if we could move forward. And as the group of healthcare partners looked at the vaccine supply and the clinics that we had arranged and what we would be able to do as we moved forward, we thought we could begin to offer that out in the community, not just in those that were living in long-term care and retirement homes. And so that was moved ahead. We very much would love to see greater supply of the vaccine. That's not something that the province can help at this point. It's got to do with the contracts and flow coming through, and they're working as hard and as frustrated to get more vaccine as well. But we're very anxious to continue to get the protection levels up in those that are older age groups. Mr. Mayor.
And I'm grateful for the effort. One of the you'd be asking a different kind of question if we had vaccine and we weren't prepared to get it into the arms of individuals as soon as possible. Then we'd I think be in a very untenable position, quite frankly. And I think we've said all along that as soon as we have it, we will get it into the arms of individuals, and it also takes some lead time to plan this out. So waiting another 2 weeks would have meant a start date of March the 15th, where we would then start booking and doing all the things that we're doing now in terms of preparation. So the quicker we can get people, even though it's clunky, and even though it's a little frustrating for individuals, it is still faster now doing this than waiting till March the 15th to wait for the provincial system, which is to address all of the appointment issues that we're considering. So it's really getting as timely as we can, as quickly as we can, and as the supply arrives, being ready to put it into the arms of individuals. And I'm delighted with the quicker response, especially on the shelter side. I mean, we've got a high risk group of individuals here that need this vaccine sooner rather than later. We've got the 85 plus with potential underlying health issues that Hamilton Health Sciences is looking after, or St. Joe's is looking after, that will get them in sooner rather than later. So it's all about responding as quickly as we can and as effectively as we can, given the circumstances. So again, supply. I wish we had, well, actually, if we had a mountain supply, it would be even more complicated right now. I think they need to roll it out in a systematic way, because we can't possibly vaccinate everyone at the same time. It's going to take some time to do, but while we're doing it, we certainly ask people for their patience, and they can rest assured that we're trying to get this done as quickly as possible. And I really appreciate the effort that our public health and all of our partners have done to do just that.
Great, thank you, Mr. Mayor. We'll just check back in with Sarah. If you'd like another question, you could go ahead.
Sure. I was wondering what the status is of rapid testing for schools and where it's occurring and what you found out.
Hi, Sarah. So the rapid testing is actually being coordinated by the school boards and by the Ministry of Education. So we're providing them some advice on how to go about it, but they're the ones that are actually coordinating that at this point.
Great. Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So we'll pass things back to you.
Okay, thank you, media, for the questions, and thank you for continuing to share this information in our broader community. It's critically important that people have as much information as possible they can utilize to make informed decisions. So we appreciate your effort, and we also appreciate the effort of Bill Custers and the entire team at Cable 14 and Clear Cable for making sure that these media advisories go smoothly, as they always do. And of course, if you need more information, the hamilton.ca/coronavirus website is available for you. There is a lot of information there, both from a vaccine perspective as well as for businesses and individuals in our community, dollars and cents that are available to you that you could apply for. So all of that information is on the coronavirus website. So please do avail yourself of that information. It's quick, it's handy, and it certainly is very useful. Our next media advisory will be on Monday, March the 9th at 3 p.m. And in the meantime, look after one another, be kind, be patient, and we will talk to you soon.